Hello, welcome, and thank you so much for joining us for today's Caring for the Caregiver webinar in honor of National Nutrition Month. This is presented by the Executive Office of Aging and Independence and the Mass Tech Collaborative. So today's topic is Food as Medicine, supporting emotional health and nutrition for caregivers. I'm Bella Santos, the Digital and Economic Equity Fellow with the American Connection Corps at the Executive Office of Aging and Independence, and I'm thrilled to welcome you to this important discussion. In today's session, Lynn O'Neal from Greater Lynn Senior Services will introduce the food as medicine approach, demonstrating how simple dietary choices can improve emotional health, boost energy, and support overall well-being. She will also share resources for continued learning through her recorded 4-part Food as Medicine online workshop series. Following Lynn's presentation, Kelly Slattery, Nutrition Program Director at the Executive Office of Aging and Independence, will share information about nutrition programs available across Massachusetts. These programs can help ease caregiving burdens and ensure that both you and your care recipient have access to the nourishment you need. In this session, you will learn how to use nutrition to support your emotional and physical well-being, identify practical, achievable dietary changes to improve energy and resilience, and access statewide nutrition programs and resources for you and your care recipient. So first, I'm pleased to welcome Lynn O'Neal, a licensed mental health counselor and certified integrative mental health professional with the Greater Lynn Senior Services. Lynn works as a part of the mobile mental health program, which brings mental health services directly to older adults through home visits, telehealth, and phone check-ins, helping those who may be isolated, homebound, or unable to access traditional care. This program provides counseling, emotional support, and guidance to address depression, anxiety, grief, and other challenges, while also linking participants with community resources that promote overall well-being. In addition to her work with the mobile mental health team, Lynn runs the Food and Thought program, which focuses on the links between nutrition, mental health, and overall wellness. In this role, she designs and delivers educational sessions such as Food as Medicine, along with other trainings that provide practical strategies for caregivers and older adults. Across her work, Lynn is passionate about providing education and support at the intersection of mental health and lifestyle practices, helping older adults and caregivers build resilience and access practical tools for overall well-being. We're also joined by my colleague, Kelly Slattery, Director of Nutrition Services at the Executive Office of Aging and Independence, where she oversees the senior nutrition program, including both home delivered meals and the congregate meal programs. The senior nutrition program serves approximately 10 million nutritionally balanced meals each year. Home delivered meals are administered by 24 regional nutrition programs across Massachusetts, and congregate meals are provided at more than 325 locations. The program also offers nutrition risk screening, education, and counseling, and some locations may provide supper and weekend meals. Kelly is a licensed dietitian nutritionist and holds a Bachelor of Science in Nutritional Sciences. Prior to joining our agency, she served as Nutrition Program Director at Highland Valley Elder Services. So thank you so much to Kelly and Lynn for being us today and being willing to share your expertise. So just before we begin, a couple housekeeping notes. A quick note for all those who are attending live today, please feel free to post your questions in the Q&A box or in the chat. You can also submit your questions anonymously if you'd like, but please do not indicate any personal or identifying information in your questions. There will be dedicated time at the end of the session to address your questions. Live transcription is enabled for this webinar. You can access the live captions by clicking on the CC or live transcript button in your Zoom toolbar. So with all of that being said, thank you all for being here today. And now I'd like to turn it over to Lynn. So Lynn, please turn on your camera and microphone and you can take it away.
Hello, everybody. Can you see me? Yes, good. It is such a tremendous pleasure to be here today to talk to you about this very important topic of food as medicine. That was a lovely introduction. I think it gave a good sense for what I do in my work at Greater Lynn Senior Services and with the Phoenix Food Hub, so I'm not going to recap that. What I will say is that this is a topic that is near and dear to my heart, both food as medicine, Also working with caregivers. I have been in a caregiving role myself, and I have worked with caregivers for the last almost 3 decades. And so I come to today with a real appreciation for some of the unique challenges that you may be facing. It's why I have tailored today's talk to focus specifically on the needs of caregivers through the lens of a food as medicine approach to helping people stay as optimally healthy physically and psychologically as possible. Next screen, please. I always like to start with this general question of why are we even talking about this, right? I do appreciate that as caregivers, you all have one of the most important jobs that there is. You know, providing care and support for another human being is a tremendous and admirable responsibility and job. It also can be one of the most taxing. And I'm going to start by just sharing a little bit of research and statistics around why I think it's especially important for caregivers to be introduced to and understand how food can be used to help promote overall health and well-being. Next slide, please. I'd like to begin with looking at some statistics about caregivers and stress. About 44 million Americans, and these statistics are a few years old. I suspect these numbers will be even higher. But about 44 million Americans over the age of 18 are currently providing unpaid assistance and support to older people in the communities or people with disabilities living in the community. And evidence shows that those caregivers, many of them are ill prepared for their role, and they're providing care with little or even no support for themselves in this role. More than 1/3 of caregivers continue to provide intense care to others while also suffering from their own poor health themselves. And we also know that people who are in a caregiving role are at higher risk for developing both, not both, but all emotional, mental, and physical health problems. And studies have shown that an influential factor in a caregiver's decision to, at some point, eventually place an impaired relative into a long-term care facility has to do with the caregiver's own struggles with their own physical health, right? And this makes a lot of sense. We can't properly care for others if we are not doing well ourselves. Next slide, please. I should mention I'm getting over a cold, so if my voice sort of fluctuates in modulation, please forgive me. I'd like to start specifically looking at caregiving and mental health. We know that there are higher levels of stress, anxiety, depression, and other mental health effects, which are common among family members who are providing care to either an older relative or friend that we're caring for. And that depression, anxiety, caregiver burnout, adjustment disorders, and substance use and abuse disorders are higher in the caregiving population than in the general population. Next slide, please. Estimates show, and again, these numbers are a few years old. We unfortunately don't have more current reliable information at this time. So, but we do know that somewhere between 40 and 70% of caregivers themselves have clinical symptoms of depression, with approximately 1/4 of them actually meeting the diagnostic criteria for a major depression. So this is more than just a transient low mood or having an off day or an off week. These are folks who have, clinical symptoms that are persistent and lasting for weeks or even months at a time. And it's not surprising because we know that caregivers often have higher levels of stress than non-caregivers. They might describe feeling, frustrated or angry or drained, even guilty sometimes, helpless as a result of providing caregiving. Also common are feelings like a loss of self-identity, lower self-esteem, constant worry, and feelings of uncertainty. Caregivers who experience chronic stress might be even at greater risk for cognitive decline themselves, including loss in short-term memory, attention, and even verbal IQ. As I mentioned previously, caregivers are at higher risk for burnout than in many other professions. And as a response to their caregiving role, we know that some folks have increased risk of using alcohol and other substances to help them cope with stressful situations. There are some stats that even show that caregivers use prescription drugs and both medical and psychotropic at higher rates than non-caregivers. Next slide, please. There are also, not surprisingly, physical health implications for caregivers. About 1 in 10, or about 11%, report that caregiving has caused their own physical health to get worse. Caregivers suffer from increased rates of physical ailments, including things like acid reflux, headaches, worse pain, even developing higher rates of illness and higher levels of obesity and chronic pain issues like with arthritis and other injury-related pain. Caregivers report chronic conditions, including heart attack, heart disease, cancer, diabetes, and arthritis at nearly twice the rate of non-caregivers. And when they are having cardiovascular responses to stressful situations, their experience can be even more intense, can feel more intense than someone who's that is not in a caregiving role. And I can't see who the audience is today, but oftentimes when I'm talking to caregivers, there's a large portion of the audience that are female. And unfortunately for those females, they are at higher risk for depression, anxiety, lower levels of subjective well-being, physical health than their male counterparts. Next slide, please. So there are significant reasons and concerns for caregivers in particular to want to do whatever they can to have as many tools as possible to help them keep themselves safe, healthy, both physically and emotionally. And there's no doubt that the mind-body connection is real. Even if we can't quantify it with specific statistical data, we do know that what's good for the brain is good for the body and vice versa. And we also are learning much more about the connection between the brain and the gut in terms of chronic disease development, including mental health concerns. Next slide, please. I cannot understate enough, actually, the role between nutrition and physical and mental well-being. Did you know nearly 80% of chronic diseases have been determined to be related to diet? And 6 out of the 10 top chronic diseases in the United States are related to diet specifically. But the good news is that many foods also offer disease-fighting benefits. So while unhealthy eating patterns contribute to disease, healthier eating patterns contribute to the prevention and even treatment, and in some cases, reversal of chronic diseases. Scientific research supports this and shows us that food is a cornerstone of all health, physical and emotional. And we also know that doing things like increasing our intake of fiber, whole grains, fruits, and vegetables, they're all ways to use food as medicine. And we're going to talk about that this afternoon. Next slide, please. For those who are not aware, these are the top 10 chronic diseases in the United States: obesity, hypertension, otherwise known as high blood pressure, high cholesterol, cardiovascular disease, diabetes, chronic kidney disease, cancer, COPD, which stands for chronic obstructive pulmonary disorder, asthma, and depression. And the conditions that have a triangle next to them, those are the 6 out of the 10 that have been shown to have a direct correlation with diet. And while depression does not have a triangle next to it, it does have a star, because there is increasing research kind of leaning in the direction of a strong correlation between nutrition and mental health. I think it's interesting that the Centers for Disease Control have actually now categorized depression as one of the top 10 chronic diseases in the United States. Next slide, please. So in the same way that an automobile, for example, needs proper fuel to function properly, right? We wouldn't put diesel fuel in a car that needed unleaded fuel. We wouldn't put leaded fuel, if it's even still available, although I think it is, into a car that needs unleaded fuel. It wouldn't run properly, and eventually it would just break down. The same thing is true of our brains and our bodies. If we are continually giving it improper nutrition, right, we're going to have all kinds of physical and emotional consequences that ensue. Now, we've known for a long time that nutrition and physical health are related and that certain foods feed disease. We are learning a lot more about the connection between nutrition and mental health. In general, the idea of food as medicine is not a new concept. In fact, it goes back centuries to the early Greeks. But what is new is that the medical field, at least in the Western world, is now starting to pay more attention to that correlation. Next slide, please. And when we look specifically at diet and mental health, the three most common concerns that I hear in working with folks who are caregivers are about around symptoms of depression, anxiety, and cognitive decline. Now, cognitive decline, actually all of these conditions, they're certainly on a spectrum. There is everything from low mood to clinical depression. There's with anxiety, a little bit of worry versus, panic attacks. And with cognitive decline, certainly when we're feeling more stressed and overwhelmed, we might become a little more forgetful, a little more disorganized. But when those conditions last for a long time, cognitive decline can fall to this other end of the spectrum where we're starting to see more lasting and significant issues with memory over the long term. Next slide, please. So the reason we're here today is to talk about food as medicine, what it is, and how can it be helpful. Food as medicine, it's much more than an idea. It is a new approach to health and health management. Next slide, please. Food as medicine endorses the practice of using nutrient-rich foods to prevent, manage, and treat chronic diseases. In some cases, even to reverse disease process. Now, this is a huge topic, and we have a very limited amount of time today to discuss it. If we had more time, I would actually show you some testimonial videos of folks who have used this approach under the supervision of a medical provider who have reversed chronic diseases over time. In the interest of time, we cannot do that today. But food as medicine is also an approach. It's not a diet per se as a fad. It's more of a pattern of eating and consuming healthful foods. And it's about making healthy choices, not things like calorie restriction or these kind of extreme food elimination diets that some folks will follow. Food as medicine knows that improving diet has been shown to relieve symptoms of depression. This slide should also say, as well as anxiety and some cognitive symptoms. Next slide, please. And when utilizing food as a way to combat, treat, prevent, and in some cases cure disease, there are two approaches we can take. The first is that we can add or increase foods to our diet that promote health. Or I would say, and we can also reduce or avoid foods that contribute to disease. Okay. Now, one of the main factors in most chronic diseases is the presence of oxidative stress. We're going to touch on oxidative stress in a couple of slides, just briefly. But what's important to know is that it is the body's response to being overwhelmed and unable to balance itself on a cellular level, right? And when the body is out of balance, it leads to things like inflammation, inability to respond to toxins, and not responding well to stress. So we're going to look at inflammation, toxins, and stress today, as well as foods that help us to fight all of those things. Next slide, please. There are a lot of foods to avoid, is what I'll say. But if we're looking at just sort of general food categories that we want to try reducing or eliminating, let's start with this. We want to try to avoid or reduce foods that are high in added or refined sugars. And I make the distinction between added sugars and natural sugars because it's an important one. Our bodies need some sugar to function properly, but it needs the right sugars and the right amounts of them. Natural sugars occur naturally in foods that often generally have other nutritive value, right? Fruits and vegetables have some sugar content, some natural sugar content to them. But that sugar is also balanced by fiber that helps the body absorb, process, and eliminate the sugar. And it also, those foods have other nutritive value. They have vitamins, minerals, other nutrients that our brains need to function properly. Added and refined sugars do not generally have nutritive value and are in foods that are not good for us. And you know, the general population in the Western world eats significantly more than we should be on a daily basis. It's not surprising because sugar is hidden in everything, right? There are more than 70 names for sugar. So oftentimes we think we're eating something healthy. It will say no sugar added or no sugar, sugar-free. What it actually means is it doesn't have sugar, but it might have fructose, it might have corn syrup, it might have agave, you know, a whole host of other names that are hidden there. So when we're reading labels, you want to look for unnatural sources of sugar, added sugar content, and we want to stay below certain amounts. If you're a woman, that amount is 6 teaspoons or 24 grams a day. And if you're a male, you get to have a little bit more, 9 teaspoons or 36 grams. The next category of foods we want to reduce or eliminate are foods that are high in saturated fats. As with sugars, our bodies also need fats, our brains need fat, to function properly, but they need healthy fats. Those healthy fats are unsaturated fats, and they are found in whole foods like nuts, seeds, and healthy oils, which we'll talk about in just a moment. And for most folks, if you're following around a 2,000 calorie diet, we want to aim for about 13 to 22 grams per day, right? What we want to avoid are saturated fats, and those come in two categories of, there's trans fats and saturated fats. They're found in animal products, so animal meats for sure, beef, pork, poultry, also full fat dairy products. They're found in things like butter, cheese, ice cream, even eggs and tropical oils. And then the third category that we want to reduce or eliminate are foods that are highly processed. Now, processed foods have been getting a lot of attention in the media lately, and I want to make a distinction between minimally processed foods and highly processed foods. Any processed food is any food that has been altered from its original form. Okay, so when you go to the supermarket and you buy a little package of baby carrots, obviously carrots don't grow like that. They have been cut, shaved, and packaged. So they've been processed, but they're still carrots, right? They're not slathered in butter or a cream sauce or anything like that. Those foods are fine to eat, right? Minimally processed foods, lettuce that's been cut, washed, and put in a bag, that's fine. What we want to stay away from are foods that have been highly processed, that have been so far altered from their original composition that we don't recognize them, or things that have just been created in a laboratory, right? That doesn't occur in nature. I'm thinking of things like Cheetos for some reason right now, but we don't grow Cheetos, right? Diets high in processed foods are consistently associated with increased levels of anxiety, depression, and psychological stress. They are also highly correlated with cardiovascular disease, high cholesterol, high blood pressure. They are found in things like bacon, ham, salami, meats, and packaged foods. Generally, any food product that has a long list of ingredients, you want to try to minimize or avoid. And these foods, if you avoid highly processed foods, you're also inadvertently going to be avoiding foods that are high in saturated fats and refined sugars, because they oftentimes have both of them in them. Next slide, please. So I love rules of thumb because, particularly in a short span of time, I can't go into tremendous detail about a lot of these things. So I'm going to give you some kind of key things to remember. I have a few rules of thumb throughout the day. These are the first 7. They are taken from a wonderful book called In Defense of Food by an author, Michael Pollan. He is a science writer. He's written several books on nutrition, including The Omnivore's Dilemma and Food in Defense of Food. I would highly recommend both if you're interested in learning more about this topic. But he says, don't eat anything that your great-grandmother wouldn't recognize as food. Right? We have to go back now 2 generations because we've had fast food and processed foods since about the 1950s. Well, we had them before that, but the industry has really exploded since the 1950s. Don't eat anything with more than 5 ingredients, or with ingredients that you can't pronounce. When you're grocery shopping, you want to shop the perimeter of the store. That's where your whole natural foods are. That's where your produce is, the butcher shop is. It's where the bakery is. Things that are made and are fresh. The middle of the store is where your highly processed packaged foods with big shelf lives are. So minimize your shopping there whenever possible. Don't eat anything that won't eventually rot. It's a little bit of an exaggeration, but we probably have all heard the adage that Twinkies have no shelf life. They just will never go, never rot. I don't think that's actually true, but a Twinkie has a long, long shelf life, and those things are just not natural. And there's a reason that they last so long. They're loaded with preservatives that are not good for us. It's also not just what you eat, but how you eat it. So we tend to eat less if we eat slower. We tend to eat less and more thoughtfully when we eat with others, right? So rather than eating dinner by yourself in front of the television, if possible, eat with a family member, eat with a friend. I love this one. I hadn't thought about it until I read this book, but don't buy food where you buy your gasoline. Interestingly, about 20% of food in the United States is eaten in the car, right? So obviously that can also encompass things like fast food, which you want to minimize as well. But I thought it was interesting, and it's true. Gas stations no longer are just gas stations. They all now have these quote unquote convenience stores, and you can buy a whole host of very unhealthy, highly processed foods. Next slide, please. Excuse me. So those are things we want to avoid. Now, in the service of let food be thy medicine, we're going to go over some food categories that we want to try to enhance and eat more of, and also some tips for incorporating more of them into our diet. We're going to look at let food be thy medicine, which may or may not have been originally said by Hippocrates. Next slide, please. Here's what a healthy diet does. It reduces and reverses inflammation. It helps reduce oxidative stress when we are experiencing it, and most of us experience it on some level, as we'll see in a moment. And it helps boost our immunity. If we have healthy, strong immune systems, we can fight off disease, we can fight off viruses, we get sick less often. Next slide, please. A very, very brief lesson on oxidative stress and why it's so bad. Oxidative stress is basically an imbalance between two different types of molecules in our body. On one hand, we have free radicals. On the other hand, we have antioxidants. Our bodies need both free radicals and antioxidants to function properly, but our bodies need them to be in balance. Right, free radicals are important for our immune health, or in us having a strong immune system, when they are at a reasonable level. When they are not kept in check, they cause cell damage and even cell death, and that can lead to chronic diseases. Now, antioxidants' role are to kind of counteract those free radicals, keep them in check so that we have stronger immune systems and can fight disease. If these two molecules are out of balance in our body, we have oxidative stress, which often results in inflammation. And this contributes to chronic diseases, even signs of aging, which I thought was really interesting. Known causes of oxidative stress are everywhere. They include environmental toxins, which are really everywhere, unfortunately. Also things like smoking and tobacco use, excessive alcohol use, and you guessed it, stress. Next slide, please. So one of the ways we can use food as medicine is to eat foods that are rich in antioxidants and help to support healthy antioxidant molecules. Excuse me. These are foods that are rich in vitamin C, vitamin E, beta carotene, selenium, and zinc. Some examples of those foods are things like the spiced turmeric, but also citrus fruits, broccoli, berries, including blackberries and blueberries, deeply colored blue and purple berries are very good. Squash, leafy greens of any kind. That can be romaine lettuce, spinach, Swiss chard, kale if you like it. Some people don't, but dark green leafy vegetables, legumes like lentils and beans, and also brown rice is a good source of antioxidant. Oh, okay. So I'm getting the cue that I have to wrap it up soon. Okay, so we have a lot more information to go to, including antioxidant foods, which are minimally processed foods, toxins. Sorry, now I'm just getting distracted because I thought I had a little bit more time. Maybe I can make the PowerPoint available to folks if they are interested, because I really would like people to understand how toxins work against us and why it's important to eat foods that have antitoxin effects. We can go to the next. I have a couple of just rules of thumb that might be helpful in this vein. Detox promoting foods, we can skip through that. Rule of thumb number 8, eat the rainbow. Foods that are brightly colored, fresh fruits and vegetables help to decrease inflammation. They provide antioxidant effects. They aid in digestion and hormone regulation. If you just add more brightly colored fruits and vegetables to your diet, you're going to be getting all of the important health benefits that you need. Next slide, please. Rule of thumb number 9, eat food, mostly plants, not too much. Eat food might sound obvious, but actually a lot of what we eat in the Western world is not actually considered food because it doesn't have nutritive value. I've created a cheat sheet for folks, a food as medicine cheat sheet. Fruits and vegetables, whole grains, nuts and seeds, fermented foods. So these are things like yogurt, kimchi, sauerkraut. If you like those things, have a tremendous probiotic benefit. Fatty fish, green tea and spices, beans and legumes, also low-fat dairy products. And if I am able to get these slides to you, it tells you why. Each one of those, it tells you why they are healthy. Change can be hard for people. Sorry, I'm not able to read all the messages that are coming in, so I'm not sure what this is all about, but I am going to try to wrap it up soon in the interest of time, and I'm happy to answer questions or even go back if we have more time at the end. Start by making small changes. And before you can do that, you really need to assess what your diet currently is, right? And is there room for improvement, and where is that room for improvement? Even skipping meals can have a tremendous negative impact on our health. So maybe we start by adding, some small healthy thing for breakfast, maybe yogurt with some fresh fruit. We want to identify healthier choices whenever possible. And add one or two of those healthier choices at a time. I have found that when trying to make changes that can be challenging, it is much easier to add something than it is to take away something that is unhealthy that we like. And there are a lot of reasons why we like the unhealthy foods that we do. And we could do a whole other training just on that. And I encourage folks to go slow and be patient because change takes time for all of us. And relapse is part of recovery. It's a saying from AA, but I think it's relevant in any change system, right? If you are trying to eat healthier and you have a bad day or you eat an unhealthy thing, don't let it be all or nothing. You just start with the next meal. You start with the next day trying again. One slip up is just one slip up. And then once you've added some healthier things to your diet and that feels more comfortable, then you can slowly start to reduce or eliminate the foods that are higher in sugar, saturated fats, and that are highly processed. Next slide, please. If there are two things I want you to take away from today's training, please eat the rainbow and keep in mind that every time you eat or drink, you're either feeding disease or fighting it. What we put in our bodies matters. Next slide, please. If you are interested in learning more on this topic, and there is so much more to go over, I at the Phoenix Food Hub do 2 in-person trainings a year, one in April, one in October. These trainings have also been pre-recorded, and you can access them on our YouTube channel, or you can go to Gliss TV. You can also contact me directly. Next slide. Next slide. Thank you very much. And I'm sorry if I went over. I really thought I would have more time. So I'm now going to hand it over to Kelly Slattery, who will share information about nutrition programs available across Massachusetts and how caregivers can access these supports. Thank you so much.
Thanks, Lynn. Go ahead and go to the next slide. So as Bella introduced in the beginning, my name is Kelly Slattery. I'm the Director of Nutrition Services here at the Executive Office of Aging and Independence, AGE for short, previously known as Elder Affairs. Next slide, please. Okay, so as a program overview of the Senior Nutrition Program, this program has been around since 1965 when it was authorized by the Older Americans Act. The Older Americans Act is the primary federal legislation supporting social and nutrition services for adults age 60 and older, aiming to help them live independently and with dignity. It provides federal grants to states to deliver services like meal programs, transportation, caregiver support, and protective services. The purpose of Older Americans Act Nutrition Program is threefold. 1, to reduce hunger, food insecurity, and malnutrition. 2, to promote socialization. And 3, to promote the health and well-being of older adults through access to nutrition-related disease prevention and health promotion services. Older Americans Act Nutrition Programming is available to adults age 60 and older, as well as the spouse any age of an older adult, disabled adults living in supportive housing where congregate meals are served, and also to program volunteers. Next slide, please. So in Massachusetts, we provide over 10 million meals each year to older adults in 2 ways. We offer congregate or community meals available at any one of the 325 congregate dining sites we host. often hosted at a local council on aging or senior center for people to come together and eat. This program helps meet nutritional needs while also providing the opportunity to socialize and participate in other activities hosted at the site. Congregate dining sites most often serve lunch on the weekdays, but depending on the needs of the community, breakfast, evening, or weekend meals may also be available. Congregate dining sites are visited twice per year by a registered dietitian who offers a group nutrition presentation or education. This year we're doing Nutrition Jeopardy. It's lots of fun. And individual nutrition counseling is also available to anyone who is interested. The home delivered meals program provides exactly the same meal as the congregate program, but is delivered to the home for people who cannot attend a congregate dining site. Individuals receiving home delivered meals are often isolated, unable to create a healthy meal for themselves, and lack the assistance to do so. Home delivered meals drivers, who are often volunteers, do more than just deliver meals. They establish a social connection and a daily check in for individuals who may not have family or support nearby. Over the years, drivers have helped and even saved countless individuals by simply looking in on them regularly. Often associated with Meals on Wheels, home delivered meals are most often a lunch meal, but depending on the needs of the individual, may include breakfast, evening, or weekend meals. And access to a registered dietitian for nutrition counseling is also available to those who receive home delivered meals. Next slide, please. The Senior Nutrition Program is funded by a mix of federal, state, and local funding. Federal funds are allocated from the Title IIIC program, which is the federal grant program established by the Older Americans Act we talked about in the first slide. Federal funding for this program prioritizes geographic areas where populations are at the greatest economic or social need. And this includes older adults who are low income, who are a racial or ethnic minority, who live in a rural community, have limited English proficiency, and or are at risk of going into a facility like a nursing home to maintain their care. In Massachusetts, the governor's budget includes a state match of the federal funds, which is called State Elder Lunch. So the state and federal funding are initially sent to AGE, and then we allocate it to 20 area agencies on aging across the Commonwealth. Those agencies, called AAAs, contract with vendors to provide services like meals to older adults. Participants are not charged for meals, but donations are always welcome, and a suggested donation is included on the monthly menu. Nutrition programs also will often apply for local grants and participate in fundraising activities to help support the program. Next slide, please. As we discussed in the first slide, the Senior Nutrition Program is a federally funded program, and therefore it is available across the country. Each state can establish its own nutrition standards. So state units on aging follow the dietary guidelines for Americans to plan for their own senior nutrition program. The guidelines are updated every 5 years, and just recently the USDA released the 2025 update. Very exciting time for dietitians as we've received a new infographic. We previously had a plate, and now we have a triangle or an upside down pyramid, however you like to see it. Standards for the Massachusetts Senior Nutrition Program are created by registered dietitians who specialize in older adult nutrition. Each local nutrition program can then create its own menu using these standards, which helps them to cater their particular offerings to the community that they serve. So the bullets on the side are sort of a quick rundown of our standards. So each meal provides 1/3 of the daily recommendation for calories or energy. We prioritize high quality whole muscle protein. We include 2 full servings of fruit or vegetable at each meal. We include whole grains. We follow a no added salt regimen. We do include dairy for calcium and protein. We have always limited saturated fat, added sugars, and highly processed foods. And we follow strict sanitation and food safety standards, specifically because the older adult population is at a higher risk of foodborne illness than their younger counterparts, and we need to be extra careful that no one gets sick. Next slide, please. Older adults are an increasingly diverse group, so nutrition programs aim to make all people feel welcome and included by providing meals that consider the unique needs and preferences of those they serve. This is a list of the cultural meals we currently have available in the Massachusetts Senior Nutrition Program. Next slide, please. To improve the health outcomes of our meal recipients, we also offer medically tailored meals. This aligns with the food as medicine movement, especially when combined with the counseling services of a registered dietitian. So these meal types listed on this slide are available across the Commonwealth with referral from a medical provider. Next slide, please. The Senior Nutrition Program offers more than just meals. Aside from the obvious benefit of a daily check-in for older adults receiving home-delivered meals, AGE partners with the Massachusetts Department of Agriculture to administer the Senior Farmers Market Nutrition Program. This program offers coupon booklets for older adults to purchase fruit, vegetables, fresh herbs, or honey at local farmers markets during the summer and the fall months. And delivery of fresh produce is also available to individuals who are homebound as part of this program. Councils on Aging also offer supportive resources, including food pantries, access to transportation for grocery shopping, and socialization opportunities. Next slide, please. So the next two slides are some infographics that address some data related to the benefits of the Senior Nutrition Program. So both food insecurity and social isolation can put older adults at risk for costly health issues like high blood pressure, heart attack, diabetes, and depression. By making nutritious food and socialization opportunities available, the Senior Nutrition Program can help older adults stay healthy and maintain independence so they can continue to participate in their communities and age in place. Next slide, please. The Senior Nutrition Program is proven to reduce healthcare utilization, prevent nursing home admissions, and generate substantial healthcare cost savings. Each year, we do a survey of meal recipients who overwhelmingly agree that the meals served or delivered improve their health, make them feel more secure, and help them to live independently. Next slide, please. So if you or someone that you care for may benefit from the Senior Nutrition Program, you can contact Mass Options at the number on the slide or at mass.gov, or you can check in with your local aging service access point. The map on the screen is an interactive tool on mass.gov, one I use all the time, which shows the ASAP network. As you can see, the entire Commonwealth is covered by nonprofit agencies who provide meals and other supports to older adults in their service area. Next slide. This is my contact information should you have additional questions, and I will pass it back to Bella and Liz for questions.
Hi, everyone. Thank you so much to Kelly and Lynn for your informative presentations. My name is Liz Gallagher, and I'm the Strategy and Analytics Manager at AGE, and I'll now lead us through the Q&A portion of this session. So while we welcome your questions, please note that we'll be addressing general topics rather than specific or highly personal situations. And if you need that individualized guidance, we do encourage you to reach out to Mass Options for direct support. And if you're unfamiliar with Mass Options, they connect older adults, individuals with disabilities, and their caregivers with agencies and organizations that can best meet their needs in their local communities. And I'm going to go ahead and paste those resources in the chat right now. And if you have attended this session today, we're also going to be sending out a follow-up email with resources that were mentioned during this presentation. So taking a look at some of the questions that we had received, first, I'm wondering what tips and strategies can help address the cost of food and improve access to appropriate food? Lynn?
Not sure how we decide who answers, but I'm happy to give some tips to that. There actually are lots of steps, and food is just expensive these days. I mean, let's face it. One of the complaints I hear a lot is that food is expensive to eat healthy. That's not untrue, but it's also expensive to eat unhealthy foods too, right? So one of the things that I found is that there are a lot of resources in the community, as Kelly just mentioned and went through, where we can get help with either free or low cost items. The other things we can do on a personal level are things like planning ahead for what we want to eat for the week, right? Buying ingredients that can be used for multiple foods or that can be used to cook larger quantities of something, freeze some of it, eat some of it now, so that we're actually saving time, saving money, saving food waste, saving on food waste. And that can reduce the cost over time as well.
Thank you, Lynn. Kelly, do you have anything to add?
I think one of the great resources that we have, especially for older adults, are our local Council on Aging and senior centers, which often have staff who can help somebody get signed up for SNAP benefits, or they host a food pantry. They host shuttles to take people grocery shopping on certain days. And then obviously they host a meal, which is free to everyone who wants to participate in that.
Great, thank you. We received one question about someone who wasn't able to attend the full webinar, and I am happy to report that we do post these webinars to YouTube. So I will be able to, I would say, post this within the next 1 to 2 weeks, and it will be available on our YouTube channel. And then we have another question, one specifically for Kelly. He asked, do you have a slide that lists the menus and ingredients of SNAP lunches and dinners? And I'm wondering if they're referring to congregate meals or home delivered meals.
Yep. So I don't have the list of menus and ingredients. Those are all posted individually. So we have 24 local nutrition programs. They all make their own menus using our nutrition standards that we make for the Commonwealth. So all of their menus are posted to their websites. And if you're curious which what I would use is that map that I posted on mass.gov, looking for an area agency that's close to where you are, and then check out their website and see their month of menus that's posted in multiple languages on their websites.
Great, thank you so much. And another question we have is someone's wondering if there are any easy, quick to make recipes using affordable ingredients that align with this paradigm. So I'm wondering, Lynn, if you'd be able to comment on that.
Sure, happy to. There actually are several, for folks who are, comfortable using the internet, which I think a lot of folks are increasingly. There are a lot of websites that you can go to look for simple, 5 or 8 ingredient whole food meals. So one of them would be the bluezones.com. That's BLUEZONES.com. And this is a fabulous website just for information about nutrition, the latest research in general, nutritionfacts.org. There's also a website called something like plantbasedonabudget.com. So if you kind of put in those key search words, whole food, easy recipes, you are going to find a wealth of information available.
Great, thank you so much. We have another question. Kelly, maybe this, actually, I guess for both, because we have 2 different perspectives. But how is food as medicine being integrated into senior centers across Massachusetts?
So I will lead with the caveat that every senior center in Massachusetts is not necessarily following the they're not necessarily an age nutrition program. So some centers are fully supported by the municipality and do not utilize federal and state funding to support their programs. So those particular programs can follow their own set of rules. They're not monitored or funded by age. The ones that are funded by age, there are 325 in the Commonwealth, are all utilizing our nutrition standards. And our nutrition standards include food as medicine concepts specifically to the medically tailored offerings that we have.
Mm-hmm. Great. And another question we had was, what shopping, delivery, and housekeeping options are available to support caregivers from the state?
So I think anybody that's that age could probably take this one, but at the local level, so at the Aging Service Access Point, the ASAP level, there's a wonderful department called Information and Referral Services. And that's generally the place that people start when they call an ASAP to say, I think, I'm either aging or my parent or my person that I'm caring for is aging, and we need support. And so that first phone call is usually the folks who say, they kind of do an eval. What is it that you're looking for? What is it that you need? And then can refer you either to programs that are housed within the ASAP or within the local community because they have sort of a hit list of, if we don't have something that quite fits your needs here, we know that they do lunch at the church on Tuesdays and it's Mexican night, and so they have those sort of local resources available to people who call. So calling information and referral services at a local ASAP can get you started with the services that you may need for yourself or the person you're caring for.
Perfect. Thank you. And Lynn, a question for you. Are there any particular food choices that might help promote calm and that emotional well-being?
Sure. I guess the way I'd like to answer this question is to say, eating any of those foods that I highlighted in Eat the Rainbow are going to help in that vein. But more importantly than adding those healthy things, when it comes to anxiety, depression, even kind of brain fog, what we really want to focus on is eventually reducing some of those unhealthy foods, because those are really the culprits that give us, that feed anxiety, that feed depression, right? So the highly processed foods, the saturated fats, and too much sugar. I mean, there are strong correlations with mental health conditions.
Yeah, thank you. And somebody had a thought, but I was wondering if either of you had any maybe advice for this. Someone was commenting that it can be challenging when someone is either very particular about food taste or has lost a lot of their taste buds. They noted that their father at the end of his life barely enjoyed anything unless it was very, very sweet. So I'm wondering if either of you have any tips for other people who might be navigating a similar situation to that.
I think this is such a very personal question, right? And I think this becomes a decision point of weighing benefits versus risks. So it's very, very specific to the individual that we're just discussing at that moment, and it's tough to produce sort of blanket recommendations. Generally speaking, it is better to eat than not. When you're dealing with any kind of an illness. And sometimes we have to sacrifice logic and reason for emotional well-being. I mean, food brings us together. We celebrate with it. We grieve with it. We use it for all different sorts of things. And for an example, not that I'm saying that this is what this person is talking about specifically, but somebody at the end of their life who all they want is a piece of coffee cake, let them eat the cake. If that makes them feel good and happy. But at the same time, if they're going to choke on the cake, that's probably not a great idea. So you have to sort of weigh those risks versus benefits when you're making these decisions. And it's such a very personal journey. But if you are dealing with someone who is sort of in that phase, it's really great as a caregiver to get some support with people who are either working in a hospital, a hospice, or, if you have a home health or a nurse, to sort of talk these things through with, so you don't feel like you're carrying the weight of those decisions completely on your own shoulders.
That's great. Thank you. And Lynn, did you have any other thoughts to add to that before we wrap up?
Well, I always have thoughts to add, but in the interest, I'm very aware that it's 1:00. So I think I'll leave it there. Yeah.
Great. Thank you. And that is all the time we have for questions today, as it is 1:00. Before we wrap up, I do want to thank Lynn and Kelly again for their valuable insights, and all of you for your attendance and engagement in today's webinar. And as you exit Zoom, please take a moment to complete the post-webinar survey. Your feedback is really appreciated and helps us improve future sessions. Everyone have a great rest of your day.
Thanks. Thanks so much.
Bye.